my personal experience, for both myself and as a professional that worked with individuals with mental health needs, if you're on medication, you usually would benefit from some type of psychotherapy. Having an individual or a psychologist that could prescribe medications, you're getting both of those services with one visit. You're not having to pay for a psychiatrist, which is difficult to get into, and then also pay your psychologist to do your therapy. You've got both, and it's really all-encompassing and more, I feel it would be, a better outcome for individuals.
It makes things easier. But what really counts is I'm talking to somebody who really knows me and my situation. And it's not just something that's kind of a quick check-in. Nothing compares to seeing one person that is your primary care provider for mental health.
Some of the most powerful moments I've had with my patients, I can't identify a single one. It has been with many of my patients, and that is usually when they say to me, "Thank you for listening. You've heard me. You're the first person that I've talked to about medication that has ever really listened to me. You're hearing what I'm saying," and that to me makes up for all the struggles that I've gone through to get to where I am. And believe me, to become a prescribing psychologist in New Mexico, it's a long road. But that makes up for it. And also the ability to take people off medication. I had a young woman, a teenager, who came in to see me, and she was on 7 medications. She had never had a suicide attempt. She wasn't psychotic, and she was on 7 medications. We took her down to 2, and she continues to struggle, but it's therapy. It's not more medication that she needed. And she's actually doing really well and is going to graduate. And those are the kinds of moments. Those are the kinds of things. It's not a particular case. It's not a particular person. It's most of my patients who've been in care before coming in and saying, "Thank you for listening. And thank you for helping."
This is a woman who came to me being treated for attention deficit disorder, adult ADD. She was on very high doses of stimulant medications, and she came in because she was troubled by the fact that if she missed a dose, if she tried to stop taking her stimulants on the weekend, she could hardly get out of bed. She was so, her motor had gone down so much. She'd been on these stimulants for years, and so when I saw her, she said, I don't even know if I have ADD. I'm not even sure if I do, because this was started years ago, and the person who saw me just asked me a few questions, 15 minutes, and we started the meds, and I don't even know if I have it, and maybe I could get off of these meds. And so I said, well, sure, let's do that. So first thing I did was I did a full sort of workup with her, a good ADD workup, including, the behavioral checklists for, self and observer, and I did some continuous performance testing with her on my computer, and I just kind of did a workup with her, and my view was that I didn't think she had ADD. I thought that it was probably not a correct diagnosis for whatever reason. So I said, well, let's talk about it. Let's see about maybe you could come off of these meds. You've been on them for a long time, so it's going to be a long, slow process. But we talked about it, and I could just see her eyes light up. It's like, you really think I could actually get off of these? And I said, well, I think there's a good possibility, and I also think that not only that, but you can learn some psychological skills to help you cope through this process. my view of this particular patient was that more what was going on with her was some chronic anxiety than ADD. And so we kind of worked on that, and she really took to it. I mean, I actually sent her to a class and on mindfulness and pointed her in the direction of some books. And so at the end of the day, she was able to successfully come off of the stimulants that she had been on for probably a decade. And it was a huge thing for her. And I got to tell you, for me, it was powerful because when I was going through the program at New Mexico State, we kept getting hammered into us. The power to prescribe is also the power to unprescribe as well.
I'm very happy that my original training was as a psychologist for the reasons I was saying a few minutes ago, that especially having witnessed 15-minute physician office visits, I very much want to talk to people about their lives and to hear a lot of background about where that problem came from, and also to use my original training as a psychologist to do testing as necessary to find out. Some people find it comforting to have objective ways to know clearly, do I really have an attention problem? Or is what's been going on more depression? And so I, as necessary, will test for that. And so I think that I can bring that extra value to working with people, coming from a background of listening real carefully and talking to people about their lives, not just what their physiologic complaints are.
I'm thinking of one who I'm managing medication for who has a bipolar disorder. And this patient came first extremely manic, had gone off the mood stabilizer medication, didn't want to be on actually a potpourri of medication, which seemed to the patient like it was too many medications. It's called polypharmacy. Had heard about that, decided to go off the medications. And this person was genuinely miserable, unable to sleep, unable to rest, had this experienced kind of agitated fatigue, and her health was crashing basically, because that kind of a condition has a negative impact on a person's physical health. And starting a mood stabilizer with that patient, and then having that patient benefit, and then working with that patient in counseling, in long-term counseling, to help her regulate her lifestyle so that she had a regularized sleep-wake lifestyle, learning to cope with stressors in a way that she didn't get so agitated by them. So combining psychotherapy and cognitive behavioral therapy in a longer-term relationship and monitoring the patient over time on the mood stabilizer, making sure, doing labs at appropriate times to make sure that the patient's health status would continue to stay improved. And it is an absolute night and day difference in the way that patient is functioning, and continues to function now as a parent, a very constructive parent and member of a family and contributor to the community. And you see that kind of just sterling examples of really needing to utilize both, combine them, have a longer term relationship with the patient, that's the most effective thing you can do. And it's very satisfying to be able to provide both, to coordinate both, and to be able to follow up with the patient.
I was working at an outpatient clinic and was receiving referrals from the Children's Psychiatric Hospital. And I had a patient come to me who had just been released. It was a female patient. She was about, I think, maybe 10, 11 years old. And she had gone into the hospital for suicidal ideation, I believe it was, in cutting. She came out on 3 psychotropic medications. She hadn't had any medications prior to her hospitalization. I immediately called the primary care physician. And I said, did you know that so-and-so just got released from the hospital day before yesterday and she's on these medications? And he knew nothing about it. The primary care physician had no clue that his patient had been hospitalized and was put on all these drugs. So the first thing, he got a little frustrated with me, a little bit impatient with me at the beginning because he thought I was calling him so that he could refill those prescriptions. And he says, this is enough medicine to kill a horse. So I said, I agree with you. I agree with you. And the reason I'm calling you is because I want to see what we can do to maybe cut down on some of these doses and some of these medicines. So we did. We started tapering off. We started tapering her off her medicines, and we were able to get her off like a couple in 2 or 3 months. Him and I working together, the primary care, and the family was just very grateful.
I can think of a case that I don't know if this really highlights your question here, but it talks more about the virtues of prescribing psychology, where a woman who was about 30 years old, who was being prescribed painkiller medication and also being prescribed Ritalin and also some benzodiazepines. And this seemed to be kind of a common scenario where someone was being inappropriately treated with way too much medicine, and for medicine for which they really didn't have a mental disorder. But I think that while there's an increasing sensitivity to people with mental disorders, that there's not often the expertise that's coming along with that. And so with the woman that I worked with, I was able to tell her, why I didn't think she needed that medicine, and what I feel is more accurately telling her what her diagnosis was and what the harm would be from her medicine, which is something I wasn't able to do before my training experiences. And I guess that came to mind because it was a complex case, and the message that we're all always given is the importance of working in collaboration with our patients' physicians. And I think that is probably why we have such a positive track record, because there is that strong value in working in collaboration with the patient's other treating physicians.
I would say that powerful experience that I have observed happens for me on a daily to a weekly basis. I work in a rural site that is approximately 60 miles from the largest city, where there is not a psychiatrist within 60 miles. And we have patients that have a hard time affording gas money, let alone a copay. Asking families and children who don't have means to financial resources to have to drive that far, where they don't even have reliable transportation or gas money, is something that makes me feel every day that I'm glad that they have access to me and other medical psychologists, because without that, they would continue to be on possibly no medication, the wrong medication, or numerous medications that may be having adverse drug reactions and affecting their body in an adverse manner. So seeing patients that be able to have a medical psychologist as opposed to no one is something that touches me every day.